Hi, my name is Caprice Rengifo and I'm going to talk about acute methotrexate-induced crystal nephropathy. Definition. Methotrexate-induced crystal nephropathy is characterized by acute tubular injury with a scattered intratubular and interstitial needle shape, golden brown crystals which are frequently arranged in annular structures. The crystals show birefringence under polarized light and are methenamine silver positive. It is believed to be an under-recognized entity. It has been reported in the absence of toxic methotrexate levels, and the crystals can also be seen in the urine. Methotrexate-induced acute kidney injury is usually reversible, and treatment is direct at volume repletion and alkalization of the urine.
Here are 5 things healthcare professionals should know about drug-induced kidney injuries. First, there are 3 main ways that drugs damage kidneys. Some drugs decrease how much blood flows to the kidneys. Examples include NSAIDs, ACE inhibitors, and ARBs. Some drugs directly injure kidneys. Examples include penicillins, cephalosporins, contrast dyes, and aminoglycosides. Some drugs also obstruct the flow of urine from the kidneys. A common cause is calcium stones from excessive or high-dose calcium supplementation. Second, patients at higher risk may include those aged 60 or older, experiencing dehydration, with diabetes, high blood pressure, pre-existing kidney disease, heart failure, or liver failure, or having recently had surgery or a procedure that used contrast dye. Third, symptoms can occur days or months after starting a new drug. Most mild to moderate kidney injuries do not have any symptoms. People with a severe kidney injury may complain of feeling tired or confused, a sudden increase in blood pressure, a sudden change in urine output, or swollen ankles and weight gain from fluid. Fourth, the most useful lab markers are an increase in serum creatinine by at least 27 micromoles per liter in 24 hours or by 50% in 7 days, a drop in eGFR by 25%, and/or a decreased urine output. Finally, patients who experience a drug-induced kidney injury may need to have their medication doses decreased or stopped altogether.
Applications in medicine. Acute renal failure occurs in approximately 2% of the patients who receive high-dose methotrexate for the treatment of hematologic cancer. Despite the frequency of acute renal failure and the occurrence of distinct urinary crystals in this context, the presence of these crystals in human tissues has not been clearly documented. It is described crystals within the kidney tubules of a patient with methotrexate-induced nephropathy.
Low-dose methotrexate is extremely effective for treating rheumatoid arthritis and other conditions such as psoriasis. It remains the gold standard treatment within the professional healthcare community and has helped many patients feel better, control their disease, and achieve remission. Taken once a week, methotrexate works by reducing pain and swelling and can slow joint damage and disease progression over time. There is also evidence that methotrexate may reduce the burden of heart disease in rheumatoid arthritis. There are 2 ways to take methotrexate, either as a tablet or an injection. Tablets enter the bloodstream through the digestive system. However, injectable methotrexate avoids the stomach and intestines, which may reduce side effects like nausea and diarrhea in some patients. You might be aware that methotrexate is also used in some cancer treatments. It's the same drug, but the dosage levels used are very different. Most people are greatly helped by methotrexate and cope with few, if any, problems. But like all drugs, methotrexate can cause side effects, and your doctor or nurse will closely monitor you for these. One concern some patients have when prescribed methotrexate is hair thinning. Hair thinning is a possibility, but it's usually slight. Another common concern is feelings of sickness, especially when taking tablets. Fortunately, there are steps you can take to help minimize this. Studies show that taking a folic acid supplement reduces side effects by up to 79%, and changing from tablets to injectable methotrexate is also proven to reduce stomach problems, whilst increasing the effectiveness of the drug. As to methotrexate and alcohol, a recent study has shown moderate alcohol consumption of less than 14 units a week shouldn't have an adverse effect on your liver. That means you can continue to enjoy the odd drink while on methotrexate. Just ensure your doctor continues to monitor your bloods regularly. It may take up to 12 weeks after reaching the best dose for your condition before you notice any benefit, so persistence is key. Remember, at any stage, you and your doctor can agree to adjust or swap treatments. A healthcare professional should always be your first port of call for information. There are also advice helplines, websites, and patient groups to help answer any questions you may have.
Pros and cons. Pros. Methotrexate treats cancer by slowing the growth of cancer cells. Another one is it treats psoriasis by slowing the growth of skin cells to stop scale from forming. And the last one may treat rheumatoid arthritis by decreasing the activity of the immune system. Cons. Methotrexate may cause very serious life-threatening side effects. One of it may cause liver damage and lung damage, especially when it is taken for a long period of time. Damage the lining of your mouth, stomach, or intestines, and this increases the risk of the patient to develop lymphoma. Issue playing Ecuador. In Ecuador, methotrexate is used, but the patients suffer this consequence in the body, and for this reason, more studies must be done so that it recommends the patient change medication. Benefits and risks.
Hi, I'm Dr. Tom Palella, a rheumatologist with Rheumatic Disease Center Physicians. What can someone expect when they're started on methotrexate? They can expect to have a medication which they tolerate quite well, and over a period of time, they begin to notice an improvement in their stiffness, their pain, their fatigue. Their energy improves, the quality of life improves, their dependence on pain-relieving medications lessens, and they get back to a more active life. The medication has some side effects, most of which are mere nuisances and are easily managed by giving a vitamin called folic acid. The nuisance side effects include sores in the mouth, diarrhea, mild hair loss, abdominal pain, and sometimes nausea. There are, however, certain serious side effects that can occur as well. These include a severe form of asthma associated with fever or chronic progressive scarring of the lungs. Fortunately, these are quite rare, are easily recognized, and easily managed.
Urine crystals.
Hey, this is Medicos Perfectionalis. Let's talk about urine crystals. So urine crystals are urine sediments that have specific shapes under microscopy. So if you know the shape, you can know what type of stone it is, and it will be of great help on your board exam because it will describe to you like the stone. Like for example, hexagonal shaped stone, it's like cystine. Rhomboid, it's uric acid, etc. So that's the topic of today's video. So these are the most high yield crystals for your exam and for life. So first we have the envelope shaped crystals. These are the calcium oxalate. The mnemonic, or the way that I remember it, that calcium oxalate stones are the most common type of stones. So the envelope is the most common shape that you see in your life. You receive and send mail all the time. So calcium oxalate, envelope. Let's go to cystine stones. They are hexagonal in shape. How do I remember it? Cis looks like 6. Okay, especially if you know French or Spanish, it's pretty close. Other, we have the struvite stone. Struvite stones are bad, like really bad. The shape is coffin, which is bad. Okay, the way I remember it, you can like say struvite as starve to death, and death is related to the coffin, of course. Last, we have uric acid. They are rhomboid in shape. The way I remember, uric acid, sometimes like gout comes into mind. And in gout, like the definitive diagnosis is to get joint aspirate, okay, to see these crystals, okay, and if you see them, they are negative birefringent and they are elongated. So here, this is the most elongated shape, okay, in this stuff. So uric acid rhomboid. So envelope calcium oxalate, hexagonal cysteine, coffin shaped struvite stones, the evil one, rhomboid shaped uric acid. I hope it's simple because it is. Now it is. And please subscribe, give it a like. You can like us on Facebook, follow us on Twitter. You can support these videos on Patreon. I'll be grateful if you do that. But for now, enjoy the day.
Conclusion. Methotrexate may cause very serious effects. You should only take methotrexate to treat cancer or certain other conditions that are very severe and that cannot be treated with other medications. Thank you.